Hey, Iowa, it is Congressman Zach Nunn. I'm here at Mercy Hospital, who is helping take care of patients of all types of background with two incredible physicians who are on the front line of helping our communities. Now, we all know this. Here in Iowa, there are over 150,000 of our fellow community members who depend on Medicaid, whether it's in the short term or the long term, to be able to take care of their health care needs and not face all of us as taxpayers with a larger burden on the back end of costs because patient care is not provided. Equally, we know that here in Iowa, we have over 60,000 families that depend on SNAP, the Supplemental Nutrition Assistance Programs that ensures not only the ability to get access to food, but to have healthy decisions going forward. Together, both Medicaid and SNAP provide an essential part of what health looks like in Iowa. And in a state like Iowa, there's no reason that any family should go hungry or not get the medical care that they need. At the same time, I recognize that this is a very important part of making sure that we use taxpayer dollars efficiently. Right now, the CMS reports that there is a over 5% rate of improper payments that are bleeding out Medicaid. In total, that results in nearly $31 billion being taken away from the program. Tax dollars that could be going to patients are being lost through fraud, waste, and abuse. And challengingly, when we look in comprehension behind this, we have nearly $500 billion being lost to fraud, waste, and abuse in the form of SNAP, Medicaid, Medicare, and Social Security. Now let me be very clear. All of these programs are ones that I'm committed to. Social Security and Medicare are items that Americans have paid into, they need, they've earned, and they deserve. And I'm 100% committed to making sure those are fully funded. For both SNAP and Medicaid, I want to make sure that we're using those funds not only effectively, but in a way that truly helps those most in need. Those families, those with urgent need, and those who are vulnerable members of our society from birth through death. That being said, I think it's more important that we hear, from some of our incredible physicians and other medical staff throughout Iowa, as well as the families who are going through that. So I'm going to introduce my friend Mustafa. He is a physician here in Mercy Hospital. His incredible wife is a physician out in Johnson, also working in pediatrics. Doc, tell us about what you're seeing.
I'm Mustafa Aldada. I'm a pediatrician with incredible organization, Mercy One, and I've been in the system more than 20 years, and I'm lucky to take care of many of our families here in the metro. We have many families that rely on Medicaid as their source of medical coverage, and we appreciate that service, and we always feel like those patients cannot be taken care of without that benefit or coverage. So definitely we appreciate any efforts to maintain that service to our patients. We take care of patients. Some of them, they need that coverage for short term as a temporary thing, or they may need it for long term in case they have some chronic condition. As you all know, healthcare is more moving to a preventive direction, and many of the preventive care can be done in our primary care clinics, and patients, absolutely, they need the coverage for that. So we appreciate any help can be done to Medicaid.
Absolutely.
Thank you so much for your help.
No, same way. Talk a little bit about this. Now, you're a great guy. You grew up in the community here. You've been practicing at Mercy Hospital. We got to see some incredible things today. ERs that are operating, but they're busy. We saw, imaging sections, the pediatric ward here, patients in need. Tell us your background and the perspectives you're seeing.
So thank you so much, Congressman Zach Nunn, first of all, for being here, taking the time out of your schedule to tour, see it firsthand of what we're experiencing even today. So your resolution, we cannot applaud you enough for your leadership and being willing to take it forward, because we know, as Dr. Aldada said, our patients need this. Not only women of childbearing age, children, and obviously most importantly those that are indigent and need this ongoing care, because the unfortunate reality is if we make this tax cut, their chronic health conditions aren't going away. Those women that are going to deliver children are now at increased risk of mortality during pregnancy because of the postpartum mortality cases that can occur. So I hope we gave you a glimpse in our emergency department that we are boarding already. Yeah. And so if we talk about chronic health conditions, and even when we see re-enrollees have lapses in coverage and see their diabetes come in now that require ICU level of care, and or COPDers that now require being put on a ventilator in the critical care unit, you can only imagine how exacerbated that emergency department would be in that situation. So for those reasons, we cannot support these tax cut or this Medicaid cut at all, because we know the impact to our patients, we know the impact to families that would have. Your SNAP program, as you just alluded to, if we don't get them the food and staple that they need early on, what is that going to create? Again, further health conditions, exacerbate the situation that we have currently, and so we want to try to minimize that. So again, I cannot applaud you enough for taking on this significant resolution and bringing it forward.
Well, gentlemen, we know that this is a team effort.
Thank you so
and the
much.
reality is, as we move forward together as Iowans, we want to be able to take care of those who are not only most vulnerable in our communities, but make sure we're being good stewards of the taxpayer dollar. Briefly, I'm just going to share, a couple of the situations we're seeing right now. We've been able to invite a number of families who are Medicare and SNAP recipients into our office. We've heard from an outpouring across the community of the value add. There are food deserts across Iowa right here where SNAP is absolutely essential for rural America to get access to this. And we're talking about seniors who can't drive into a food distribution center to food deserts right here in the middle, in the heart of Des Moines. If this is happening in the heart of the heartland, then we need to make sure these SNAP dollars are being used effectively. Challengingly, these are also being, taken out when people commit fraud against these areas. Some of the challenges that we've seen in SNAP are that the 13% fraudulent waste and abuse of this. These are things that we should crack down. That doesn't come from just cutting budgets, it comes from fixing systemic problems. The same is true on the Medicaid side. While we have so many vulnerable Iowans, over 150,000 right here in Iowa, we need to make sure that those dollars are going to the facilities to help make them better and to help keep them healthy. Challengingly, we've seen too many states who have not reported back their reimbursement, or when a Medicaid patient moves from state to state, those billings continue. That's taking money away from the system. And as I highlighted earlier, the GAO estimates that $31 billion was lost due to this poor management and waste within the system. That's money that we can put directly back into the health of our communities. So working together, we can not only make sure that Medicaid and SNAP continue to be incredibly important programs for the health and safety of our communities, but we can cut down on that waste to really ensure that those dollars are going to the people who need them most. With that, Iowa, we'll keep fighting for you. I look forward to rolling out this bill and making sure that Iowa's voice, our best practices, our practitioners, and our patients have the best possible care we can provide.